Hi again, this is Dr. Sanders here at Integrated Health Solutions with another tip of having pain. Here's what you can do. If any of you are struggling with pain in these areas here, keep watching and discover what you can do to help eliminate or alleviate that pain, and some tips and tricks to help you keep it that way.
A lot of people with pain in this area may notice issues that start along the side or front of the neck and then travels upward. They might feel pain around the eye, into the temple or forehead, into the cheek or jaw, sometimes even into the ear. Some people describe it as a dull ache. Others say it feels like pressure, a headache, or even something similar to sinus or ear discomfort. And one of the most confusing parts is that the pain doesn't stay in one place, it spreads. The muscle involved here is called the sternocleidomastoid, or lots of times abbreviated the SCM. It's this long muscle that runs from right behind your ear down to your collarbone. Its job is pretty simple. It helps to turn your head side to side, helps tilt your head, and even assists with breathing when you're taking deeper breaths. So it's working a lot throughout the day, even when you don't realize it. This muscle can get overworked pretty easily. Think about how often your head is leaning forward, turned to one side, or held in one position for long periods of time. Over time, that constant strain can create tight, sensitive spots in the muscles. And instead of just hurting in the neck, those spots can send pain upward into the face and head. So even though you feel it in your forehead or eye, the source may actually be right here in the neck. So the most common things that can aggravate this include sitting at a computer for long periods of time, looking down at your phone, sleeping in awkward positions, such as sleeping on your stomach, holding your phone between your ear and shoulder, long drives, or even shallow breathing when you're stressed. All these keep this muscle working more than it should. Depicted here in the video is a simple massaging technique that can be used to help to greatly reduce the tension buildup in the muscle. As you can see here, you start with one head in one direction and the head then tilts into the other direction. And you'll probably want to do 3 to 5 passes, and if you have active symptoms, 3 to 4 times a day while active. And then once not active, but knowing that you still are prone to this situation because you do sit at a long desk or some of the other things that are already mentioned, you'll do, as recommended, is 1 or 2 times a day. Should do a lot to really help that muscle stay healthy. If nothing happens while doing this technique, if you have active symptoms within the first 5 to 7 days, as in it doesn't positively start to reduce down, then there could be other compensations going on that, although the muscle itself is being addressed, it tightens back up because of a dysfunction or an imbalance in how your body is holding the head, which is not allowing the work that you're doing to fully set in because it needs to compensate. And perhaps your body's just been used to a posture where your head has to be forward because of adapting to sitting at a desk in front of a screen for long periods of time, or other similar abnormal postural positions. So if you find yourself in that situation and it's not quite reducing down, that's a good time to seek someone's help that can analyze the moving patterns of your head and upper body to help address that compensation pattern. We here at Integrated Health Solutions, our doctors, we provide this type of in-depth analysis and treatment where we figure out what the balance is, what tissues are primarily causing it, and put our patients on a path not only with treatment, but empowerment of what they can do to better manage this condition or the tension in this muscle down the road so they don't need as much care in the future. Sometimes the body can be a little misleading. Pain in one area doesn't always mean that's where the problem is coming from. Understanding how these patterns work can help you take better care of your body and respond to pain a little more confidently. Take it slow, be consistent, and then listen to what your body is telling you. Check out more of our content at our YouTube channel or on our website to learn more about other areas of discomfort and what you can do to help them out.